The scholarly literature on the specific topic of assisted ADC within the context of bereavement was highly limited. A literature review provided for a framework through the compilation of articles and books on the main constructs of ADC, bereavement, and mediumship. Most academic literature was focused on the spontaneous form of ADC. It has been acknowledged by various scholars and professionals in hospitals, nursing, and counseling settings. It can be perceived on various sensory levels, including any one or combination of seeing, hearing, feeling, smelling, or sensing the presence of the deceased while awake or asleep. Individuals who have experienced spontaneous ADC will often comment on how intense or sometimes even life-changing this experience was for them. Spontaneous ADC is considered a common phenomenon, especially during bereavement, in the form of sensing the presence. The prevalence for experiencing this phenomenon ranges between 30 and 80%. Gender specifics revealed that women are more likely to report their experience of spontaneous ADC, but it is uncertain as to whether women are more likely to actually experience it or be more likely to report on such an incident. The experience of spontaneous ADC seems independent of cultural background or religious beliefs. Professionals note that individuals tend to be reluctant to discuss any spontaneous ADC out of fear of being pathologized. This may be due to poorly or misinformed mental health professionals. Several hypotheses have been established regarding the origin of spontaneous ADC, or what brings them about. One is survival of consciousness hypothesis, meaning the individual received communication directly from the deceased spirit, and that consciousness continues to exist after death. In philosophy, the term substance dualism is used to describe the view of a differentiation between physical and non-physical body. Another hypothesis is the biomedical view, in which such visions or perceptions are attributable to chemical or biological processes without supernatural causes. Persinger, in 2001 and 2006, noted epileptic seizures in the temporal lobe area of the human brain caused by geomagnetic activity may cause spontaneous ADC experiences. Benthal in 2004 and Devers in 1994 noted drug intake, organic disorders, and stress for hallucinations or visions as attributable to spontaneous ADC. A third hypothesis is psychopathology. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, plays a role in this, as it is the standard tool employed by mental health professionals in diagnosis. When assessing spontaneous ADC, a client's cultural beliefs as well as perception and feelings associated with the experience need to be included. There is currently no scientific proof that consciousness continues to exist after death. However, from a constructivist perspective, there needs to be respect for the individual's view on the reality of the spirit world and in the possibility of communicating with it. The Harris poll conducted in 2009 found that between 82 and 91% of American adults of Catholic, Christian, and Protestant faith believe in the survival of the soul after physical death. These significant numbers cannot be ignored, even though there is no scientific proof. Mention-worthy is that research shows that individuals who have experienced ADC note that it had a healing effect and was a positive experience. Facilitated ADC can be experienced through a psychomanthium, which can be described as a mirror room. Moody and Hastings et al. Have conducted research using such contraptions. While gazing into the mirrors, visions or perceptions of deceased loved ones come up, allowing for communication. Induced ADC, or IADC, was developed by Botkin and Hogan in 2005 through the use of EMDR, eye movement desensitization and reprocessing, a psychotherapeutic procedure used in treatment of trauma. ADC experiences made while receiving IADC are similar to those noted in spontaneous ADC. Research in the use of facilitated and induced forms of ADC note that it has a high success rate, up to 70%, in grief treatment. No scholarly literature was found regarding bereaved individuals' experiences of assisted ADC at the onset of this research. However, in late 2013, Evenden, Cooper, and Mitchell noted that 3 participants in a grounded theory pilot study reported positive and beneficial outcomes from attending a reading with a medium. Further, 2 dissertations were conducted by Cronin and O'Neill, and both noted potential healing or benefits of visiting a medium during bereavement. Both researchers, however, failed to examine the actual recipient's experiences and impressions. The discovery of this gap in the literature motivated the exploration of assisted ADC from the perspective of the lived experience of the bereaved individual. A striking article on telepresence came up during the literature review on ADC. It is a fascinating development of technology to allow for a form of immortality. Android beings created in the form of a living person and programmed with personality features as well as knowledge of that individual could continue to exist after the demise of the human body. Those bereaved by the passing of that individual would then still be able to communicate with the android clone being of the deceased. Of course, this brings about a number of ethical and legal dilemmas, which may well need to be dealt with in the future. Certain positive benefits have been noted in research regarding spontaneous, facilitated, and induced ADC. Mainly, the majority of the participants involved in such studies encountered a healing effect and derived psychological benefits. A frequent consequence from ADC is the strengthened belief of an afterlife, with the possibility of someday being reunited with the lost loved one. This strengthened belief can then alleviate anxiety regarding death. Findings warrant additional research in the area of ADC in connection with bereavement. When examining the literature on grief theory, it is evident that the traditional model is based on Freud's work from 1917 called Mourning and Melancholia. Traditional theory is founded on ending of relationships with death and the need to accept death as final. Stage models were then developed, largely influenced by Elizabeth Kubler-Ross in 1969. The stages are denial and isolation, anger, bargaining, depression, and acceptance. Although Kubler-Ross developed these stages to describe the dying process, it evolved into grief models, due to the similarities in feelings individuals experience. Noteworthy is that Kubler-Ross believed in an afterlife and wrote a number of books on the topic, continued relationships or communication with spirits in the afterworld. These thoughts, however, were not included in her theoretical model. Over the years, other grief models based on stages or phases were developed by Parks in 1972, Bowlby in 1980, and Warden in 2009, for example. Continuing bonds theory was introduced by Klaus, Silverman, and Nickman in 1996. This theory allows for the continuation of relationships beyond death. Researchers who study ADC tend to note the continuing bonds theory as it supports the efforts of clients who have either experienced spontaneous ADC or wish to experience assisted ADC. Literature regarding grief counseling notes that studies conducted in 2009 and 2008 by researchers such as Niemeyer, Currier, Jordan, and Berman looked at the efficacy of grief counseling. They found that many services may be ineffective and that specialized bereavement care deserves to be explored, as grief is unique to each individual. In general, spiritual factors such as belief in an afterlife or ADC topics tend to be overlooked in psychotherapy. It has been noted that within the mental health profession, death-related topics in general have been neglected in training and education. This may be due to the movement from a psychosocial to a biologically focused approach in diagnosis and therapy. Counseling professionals are called upon to focus on the therapeutic effect of such extraordinary experiences as ADC, instead of examining the scientific validity or reality of the encounter. The literature review process included an investigation of the history on mediumship. Evidently, mediums exist in virtually all cultures. In Western society, the height of medium prominence was in the Victorian age, within the spiritualism movement. Spiritualism evolved into a monotheistic belief system or recognized religion, along with churches and reverends. Spiritualism incorporates the presumption that spirits continue to exist after death, and that mediums have the ability to communicate with these spirits. People usually associate spiritualism with seances, which were a regular type of entertainment in the late 1800s. Today, spiritualist churches are organized in the United States, Great Britain, and Brazil, for example. Research on mediumship has been conducted since the 1880s through such organizations as the Society for Psychical Research in London. A predominant figure of the SPR was its president, Henry Sidgwick, professor of moral philosophy at Cambridge University, who had enormous standing and moral authority in the intellectual circles of the day. Today, a number of researchers and institutions located all over the world are involved in studying mediumship and associated anomalous communication. There are several hypotheses regarding how mediums work or how they receive the information they report. One is that mediums receive their information from the spirit in the afterlife. Another is that they telepathically read or retrieve the information directly from the client. A third hypothesis is that there is a psychic reservoir in which all information from all individuals is stored, which the medium can then somehow access. Mediums in the past have also been pathologized as schizophrenic for reporting on visions or voices. Skeptics assume mediums employ cold reading or other forms of trickery to fool the client, and just as in all occupations, fraudulence can never be ruled out. There are a number of different opinions regarding the use of mediumship readings as part of grief counseling. A major adversity in incorporating mediumship readings as a bereavement care tool in grief counseling seems to be the lack in standardization or certification of mediums.